this video is for trauma-informed care. So where do we start with that one?
I think it's important people keep in mind when they're working with folks to just approach them with compassion.
People know the term trauma-informed care, but I'm not sure they know exactly what that is. I think we should explain that a little bit.
It's when you approach people assuming that there's a high possibility of them having a trauma history. So you are putting the control into the person's hands, really making sure that you are doing everything in your power to provide a safe and secure interaction.
70% of adults in the United States have experienced a traumatic experience. And I think that's something that volunteers should really be aware of.
Absolutely.
Because if they're providing trauma-informed care, we should pretty much assume 70% of people have experienced a traumatic event.
Right.
So how does this look in action? Like, for example, you were talking about the other day, there was a client that didn't want anything to do with anybody who was male because they felt very uncomfortable around people, males in particular, that they did not know.
Right.
So how would you honor that person's feelings in a way that was trauma-informed?
The biggest thing is making sure that they have control. You're giving them their autonomy and honoring their wishes. So if the person is telling you that they're not comfortable with men they don't know, if they're not comfortable being in a certain space, you want to make sure that you are honoring that. So you might find an alternative. You might find somebody else who's a female that can work with them. You might be present for any interactions, helping a safe, secure relationship develop if a female staff wasn't available.
Mm-hmm. Gosh, it all sounds like very middle path work, right?
Yeah.
Like you working with, like a volunteer working with a client and then coming up with a plan that's going to support the goal and also the client feeling safe.
Right.
Yeah, and safety is one of the 5 core principles of trauma-informed care. So I think that's something that we should really be focusing on.
That's true.
Right.
Yeah, safety is a big part. Like at my work, we always make sure that patients know what's going to come next. We make sure that we give patients education so that they have a choice. They can make their own decisions, going back to the autonomy like you were talking about. And then they feel safe because they feel they're being taken care of instead of having that power differential, you know.
Also, if you're working with people on the street, maybe out in the woods, when you're approaching them, it's really important to honor their space.
Mm-hmm.
So a best practice for me is always asking first. I always ask, one, for their time, if they'd be willing to spend some time with me. And if they say no, that's okay. Walk away and maybe reapproach later. If you're entering their space, I ask permission. Is it okay if I come in?
Yeah.
If you are making any contact with the person you're working with, even their wheelchair or mobility equipment, that you ask permission for that as well, because their equipment they may use is an extension of them.
Mm-hmm.
That is such a really valid point. Anybody's willingness to participate in a conversation or a plan or a goal should really be assessed. We have to make sure it's all about the person that we're helping and not about ourselves.
Right.
So one of the second core principles is collaboration. And it seems like what you guys are talking about too with the safety is collaborating with the client to make sure that they're feeling safe.
Absolutely.
And that's kind of like along that middle path thing that you were saying earlier, right? That's like they have input, you have input, and then together you can work on goals that are important.
So I worked with this person at a clinic that I worked at, and they were IV drug user. And they had this really giant abscess on their arm. And every time I saw them, it got worse and worse and worse. And I was trying to get them to go to the medical appointment, and they kept saying, no, it's fine, it's fine. And as we would meet more, I would see it getting worse. So I knew it wasn't fine. And I asked him, what's going on? Like, what is the barrier to you going and getting care? And they were afraid that they were going to be lectured about substance use. They were afraid that they were going to be forced to go to inpatient clinic. They were just worried about judgment in a clinic, a medical setting. So the second time I met with them, we were working on middle path thinking, right? Which is, how can we support you in getting your arm checked out?
Right.
And how can I help you feel safe? So the plan was the next appointment that they came to see me, we would have a medical appointment scheduled at the same time, and me and them would walk over to the medical clinic together. I wouldn't go in the office with them, but I would be able to advocate if needed to support them. So it ended up working out. They went in, they had the doctor look at their abscess, they were given antibiotics, it was drained. They probably felt a lot better and a lot healthier. And that was kind of their way of also building mastery, which is the concept that you do small steps to build trust in something you're doing or confidence in something you're doing. And she was able to go to that clinic on her own next time because she knew her doctor now and she knew it was safe.
That probably didn't happen overnight, right? You've been building a relationship with this person for a long time, developing trust,
Yeah.
allowing them the space to be comfortable with you, right? Trust takes time. Developing the relationship takes time.
That's true.
And getting somebody to that point to collaborating with you to make a plan to get care is going to take time, and they have to be able to trust you, right? To know that you're going to show up for them.
What about the concept of empowerment, building people up?
You know, I do a lot of work with people at the hospital and people I've worked with over the years about empowerment and control. So I talk about the circle of control versus the circle of influence. And I think folks are it's really easy for them to forget how much they actually have control over when you've got all of these systems, all of these providers telling you how things work, telling you what's needed in the moment.
That's so scary.
Yeah, it can be for folks.
Yeah.
So a lot of the work I do is really helping people remember how much power they have. So we have control. We have a lot of control in our lives. We have control over our breath, over the words we say, who we spend our time with, how we spend our time. And those may seem like simple things, but those are things that can really shift people's perspective and help them take back some of the power.
So we agree. Safety, choice, collaboration, trust, and empowerment.
Yes.
Those are all the 5 core principles of trauma-informed care we need to talk to volunteers about.
Correct.
Yeah, absolutely.
Sometimes people's missions are not as genuine as they think, right? So it could be that they're trying to fix somebody. It could be that they're trying to build their ego up and feel like a good person.
I've definitely seen that.
Over and over and over.
Over and
We've
over.
seen that so many times. And what ends up happening when a volunteer leaves because they're not getting what they need?
Our clients get hurt.
Every single time.
And they internalize it. They think that they're to blame.
Yep.
Yes.
Yeah. And then what happens when they meet a new volunteer?
They don't trust them as easily.
Nope.
Yeah.
That relationship takes longer to develop. This might be challenging work, and it's worth it.
It is worth it. It's really rewarding.